Plantar fasciitis is a condition of the heel that we see very frequently. Plantar fasciitis is an inflammatory condition of a ligament that attaches to the heel and runs through the arch. It is inflammatory in nature and tends to be an overuse type of injury. We see plantar fasciitis typically 1 in 10 of our new patients come in with plantar fasciitis, and is a very common malady that people experience. Your typical presentation of a patient with plantar fasciitis is that of a very gradual onset of pain, particularly in the heel, sometimes extending through the arch. And your classic plantar fasciitis is a dull, aching to sharp pain in the heel. It tends to fluctuate in intensity over the course of the day. Most patients will report pain is horrible in the morning. They get out of bed, they're having to lean on the furniture because the heel and oftentimes the arch is so extremely painful for a while, and then it seems to go away. It will reach a tolerable level where they no longer have pain. Sometimes pain goes away completely, and only for it to return by the end of the day with activities, or patients to sit down for any length of time and then get up and walk again, thinking they were better. All of a sudden the pain is terrible again. Plantar fasciitis, by definition, is an overuse. So at some point there was an overuse injury to this ligament in the heel, and the structure itself failed. The forces that went through the ligament could no longer tolerate, and there was a tear or microscopic rupture at the ligament where it blends into the heel. Oftentimes we'll see patients come in and they've started a new job, for example. They're standing on concrete. Now they're working as a cashier instead of working in an office, and they do this for a period of a couple of weeks and then report this development of heel pain. Oftentimes people say, well, I went away for the weekend, did a lot of walking at blank city, and on returning, the heel pain started. The third major one that we see is patients that say, well, I decided I'm going to get healthier. I'm going to start exercising, and they become quite frustrated because 2-3 weeks into that, they've got this heel pain, and now that's stopping them from exercising. But it's typically that we've changed activities from our norm, and now this new activity has overloaded the heel. To treat plantar fasciitis, we have to understand what the issue is and how the foot functions. And if you look at the foot very simply, it functions in 2 manners. One, it absorbs shock when you're placing weight on your foot. And secondly, it becomes rigid when your heel comes up in the course of walking to maximize forces to push off the foot. So the plantar fascia is under a constant tension and relaxation, and the overload that causes the failure of the plantar fascia is contributing to the problem or the inflammation that you've developed. Once you have the inflammation of the plantar fascia, the keys to treating it are: 1, reduce the inflammation, and this can be done with ice, elevation, restricting the activity that started the problem in the first place. Number 2, supporting the arch, and supporting the arch is done through over-the-counter type of arch supports are very helpful, making sure that the shoe that you're wearing is well constructed, sturdy, also avoiding barefoot walking at home. The plantar fascia tends to get overstretched again and becomes inflamed if it's not supported. There are different stretches that are readily available on the internet for plantar fascia. Because it's such a popular diagnosis, there's a lot of information that's available. Standard stretching and things like that of the foot are very helpful. We often find that the Achilles tendon is implicated in plantar fasciitis, and you'll see the majority of patients with plantar fasciitis have a tight Achilles tendon, and some people respond very quickly to simply stretching out the Achilles tendon. It's not a procedure that we have to operate on routinely, but there are standard procedures that we have, and the general standard of care would be a patient that failed 6 months of conservative therapy. They would be considered candidates for surgical repair. And the surgical repair would involve release of the ligament. We see a lot of patients that will come in wearing flip-flops and sandals that are not contoured to the foot, and it's really a contradiction to what you should be doing. You need that foot supported, and if not, the plantar fasciitis just becomes chronic in nature. If symptoms are persisting despite having done that treatment at home, then it's time to come in and get evaluated. There are other causes of heel pain that will mimic plantar fasciitis and won't respond to the classic treatment of plantar fasciitis. Frequently I get asked from my patients regarding obesity and the connection with plantar fasciitis. And certainly if you look at the foot as a structure, the foot is designed to bear a certain amount of weight, and any overload is going to contribute to problems such as plantar fasciitis, inflammatory issues, arthritic type pain in the foot. But most patients will come in and be resistant to having come in saying, well, I'm overweight and I know that's what you're going to tell me and that's what the problem is, but that's not the case. Plantar fasciitis is seen in the population of people with all sorts of body habitus, and don't just assume that, well, I'm overweight, so my problem is not going to go away until I lose the weight and I'll be stuck with this chronic issue. This is not the case. Although it's a contributory factor, it's not the cause of plantar fasciitis.